Thank you everyone for joining us. And this conversation is very well timed and well programmed to the team, coming after Peter Sand's comments about catalysts, about impact, and about what actions now will actually have transformative impacts on people's lives, because time is short and people are dying every day. And one of the major issues related to that access and equity is access to medicines. And so that's what this conversation will be focused on, and the ways in which different organizations, international organizations, civil society, private sector can really work together, again, as we were just discussing, to streamline those activities and make them more efficient to drive near-term, faster impact. And so, Lisa, I'd like to start with you. What we've also been talking about today is increased demand and decreased funding. And when you're thinking about the role of the WHO, and specifically as it relates to access to medicine, and when we're seeing data come out of the World Bank where the number of countries that are actually reducing the amount of investment in public health, how do you reconcile those things, and how is the WHO thinking about it as it specifically pertains to access to medicine?
Thanks so much. I think that there are a number of things that we have to think about as we move through this week at the WHA. A lot of initiatives will come forward that shape what WHO does in our global plan of work. But one thing we know for sure is that access to medicines will continue to figure in a very, very prominent way. It's also important that we sort of listen to all of the things that the people before us have said and recognize that access is actually a fairly complex chain of events that need to happen. They need to come together to actually form an end-to-end approach. And one of the things we like to do is say, well, how can we summarize that? And when we think about a person who's trying to access medicines, it comes down to affordability. It comes down to accessibility. Can they get it? And it also comes down to acceptability. Is it something that actually can be made to work in a particular context? So you brought up equity, and equity is another component. And equity can look a little bit different depending on the context. It can be an emergency context, or it can be something that's an ongoing situation. But at its core, what it speaks to is that we have an environment where all people have those three dimensions, that it's accessible, affordable, and acceptable. As Pete was saying, investment is critical. And investment has a huge impact on whether or not something actually goes forward as business as usual, or if it's accelerated, it gets there faster, it gets there to more people. What is it that the investment is trying to do is a critical question. But I think one of the things that we have to think about, and one of the tough questions, is that investment can happen at any part of the value chain. It can happen at the manufacturing level. We talk a lot about that. We talk a lot about that in terms of medicines that are in shortage. We also talk about investments in supply chains, and we talk about investments in what we often call the last mile. We have to remember that for the patient, that's actually the first mile. So depending on your perspective, that can be different. So investment can happen anywhere. But one of the things we are very sensitive to is that there are situations where there really isn't investment. There may not be sufficient investment, there may be no investment. And I just want to use an example of something that we don't talk about very often. There are, for example, rheumatic heart disease. This is something that actually can be prevented with a very, very simple, very inexpensive antibiotic. Yet that antibiotic is hard to find. It's benzathine penicillin. It's not a blockbuster. But it's been running around in shortage for almost 10 years. And so when you think about 40 million people who are affected, disproportionately young people, disproportionately women, this is something that can be fixed, but it is going to require investment in all of those aspects of the supply chain. We also have countries with limited purchasing power. That's another place. So when the country system itself can't uptake these innovations, as our other speakers were talking about, this actually is another kind of problem. So we have to think about, well, how do we combat that? There's lots of different things that can happen. One is pool procurement. That's not easy. It sounds really great. It's not an easy thing to do, but we do have examples. And there's a group of countries, the small island developing states in Africa, who are coming together to create a pool procurement mechanism. But it's not necessarily about driving costs down. It's about having access to that quality assured market so that what you are purchasing is of quality, and it's going to actually treat that person who who takes that step to walk up to their first mile to access those medicines. So stabilizing the market for them is a little bit more important than actually lowering the price. So I do want to just say one thing about all of the partnerships that have been discussed here. And just to be really realistic, there is no one entity that can do this alone. There isn't. It's just not realistic. And so when you think about partnerships and how important they are in that access value chain, we think about regulators who rely on procurers, who rely on research and development, who rely on clinical guidance, who rely on, you get the picture. It just keeps on going on. And so thinking that any one entity can manage that alone is just not reality-based. And so we really do need to make sure that when we develop partnerships that we act on them, that they're strategic and that they work well. I really appreciated Pete's comments. WHO partners with Global Fund, Gavi, other UN agencies. Those came up during COVID with the ACT-A partnership with COVAX. Those were some pretty tough times. But without those partnerships, the good things that happened wouldn't have happened. We all know about ways to get things from those innovator companies into generics. We partner with the Medicines Patent Pool. Those things, again, they can happen in tough times, but a lot of good things can still happen. I know a lot of the speakers are coming together here for the first time, and we're really grateful for that, but I'm not going to pretend that I don't know Susana. And I want to just call that out because that's a key partnership. We also have collaborations with industry that are extremely important. If we don't collaborate with industry, the approach that we take, even when we try to piece all those bits together to say this is what access looks like, it's got to be sustainable access. So really grateful for that, and thanks very much for that question.
Yeah, and thank you for joining us and providing that framing for this conversation. And for introducing Susana, I'd like to turn to you next, and it's a great segue. It's important to talk about access through the value chain, as you were noting, Lisa. And Susana, from your perspective, you have extensive experience in generics and biosimilars. And when you're thinking about the industry's role, how are you conceptualizing that as it relates directly to your work and issues of access specifically, and then the kinds of partnerships that are driving impact? And appreciate the reality check and wanting for candor here. What is working? What isn't working? And what can we learn from your experience?
Thank you very much. IGBA, we're the International Generic and Biosimilar Association, and we work to represent the various generic and biosimilar associations across the world. Our role is to strengthen the collaboration among them at the local and also regional level, and represent the generic and biosimilar manufacturers around the world. We work to enable innovation and access to improve access to quality assured, safe and cost-effective medicines to patients all around the world. And we do that by advancing the global efforts that can improve access to medicines by, for example, promoting the regulatory cooperation and international convergence, which is extremely important, namely the harmonization of standards, to have balanced and robust intellectual property systems that foster innovation and maintain the sustainability of the medicines manufacturers. This is all, of course, in the best interest of patients and the health systems, because that's what essentially all of us around the table and here during the week are trying to achieve: get the patients to get the medicines to those who need the medicines. Our industry supplies the large majority of the prescription medicines to most patients around the world. We've heard in the previous session a great example of this regarding the access to medication for TB, malaria, and HIV. And generic manufacturers and generic medicines have enabled to get treatment to those conditions to millions of patients who are living in lower and middle income countries. So what we have is unique experience that is helping us identify barriers to access, and we seek to help create innovative solutions that will improve the access and meet the needs of also the health systems. When we talk about universal health coverage, that will not be possible without timely access to these life-saving therapies and affordable and quality-assured medicine. So I think this can only be done through partnerships. One of the things that I keep hearing in all of the conversations this week here in Geneva is that we all want access to patients, access to medicine and treatment and healthcare to patients. But what that means to each one of us is really not the same. So making sure that we understand each other's perspectives and come together to find solutions that work, I think this is the key that we can help unlock with our conversations here and continue to develop throughout the year. So this does not end here, it begins and continues here, but the real work that we are doing is done throughout the year. Because in essence, while as organizations and stakeholders, what access means to us might be different in the end. I am a mother, I am a daughter, and what access means is when one of my family members is sick, getting access to the treatment that will help make them better.
One quick follow-up question to you, and then Alef, I'd like to turn to you about community-based experience and a lived experience on the ground. But a quick follow-up to your question as it relates to generics and biosimilars. There have been has been an evolution of manufacturing trends around the world. And as you said, distribution is incredibly important to facilitate access. What can you say about those trends around the world to ensure greater manufacturing around the world in different hubs so that there can be more streamlined distribution in places that need more access?
I think here when we talk about this, it's important to understand that one size is not fitting all, and we really have to see what makes sense in the different geographies, in the different contexts, to understand how we can help make that access possible to the patients. So it's really my message there is we don't have a one size that fits all.
It's an important point to remember. And you've both made really important points that lead me to Alef in terms of the first mile, the last mile, access to medicine, and the experience that people are having who don't necessarily have access to the medicines that they need. And you've been doing tremendous work on the ground in that respect. And so I'm wondering if you can share your perspective in the work that you're doing about the relevance, the urgency of these issues in terms of access to medicine.
Thank you. So with Rhiza, we solely focus on the last mile. So our aim is really to start clinics in underserved areas where there's no access to healthcare nor medicine in general. Or if there's access, there's limited access. So I'll give an example. A township in Johannesburg, South Africa, called Diepsloot. It has anywhere between 100,000 and 1 million people. I know it's a very broad census, but no one really knows how many people live there. But there are 2 government facilities that provide primary health care to those people, and it's not enough. People queue there from 5 in the morning and often are not seen, and therefore have limited access. So we built a clinic there as a satellite to a public healthcare clinic. And by doing so, we're able to provide life-saving care based on HIV treatment and care, based on TB treatment, but also based on preventative sexual reproductive health care that other people otherwise wouldn't have access to. Why is that interesting? Is because here you have a public-private partnership where government buys ARVs from Viatris, for example, who is a partner of this conference. They buy that at a reduced rate because they have a deal with Viatris, but at the same time, then government gives us those ARVs so that we can provide them to patients. But we are a private clinic, so we make patients pay a minimum fee for it, but that reduces the cost and therefore creates more sustainable models on the ground that can lead to access to medication. Another thing that's important to note is that not everything needs a doctor at the last mile. So for us, having community health workers, having nurses, having nurse-led clinics, again, reduces the cost to the end user. to the patient in this case, and then therefore ensures that there's higher levels of accessibility and higher levels of affordability when it comes to those services. So for us, those two components together, on the one hand, access to medication, and it can either be through partnerships with one of pharmaceuticals directly, or it can be in a public-private partnership with integrating our clinics within a larger ecosystem, health ecosystem. The other is to ensure that the affordability for the patient is as low as possible. And so those are two ways in which we do that. Then more on a preventative front, I think a lot of people underestimate the importance of sexual reproductive healthcare services because it's difficult to do. And it's difficult to do because there's a lot of, as been mentioned before, there are a lot of taboos around providing sexual reproductive healthcare services. So things that we do is we link our clinics to a sports facility. On our mobile clinics that we have, we build a basket on top of them so that the kids that we engage with, their defense levels drop because they're engaged with sports, and then you can engage around more difficult topics like sexual reproductive health. So innovation doesn't always have to include technology. It can be simple things like that, but it really is context-driven. And those are, I think, three main points for us as to how we provide more access to primary healthcare in general, or community healthcare, and then link that to relevant medications.
You raised so many important points about context mattering, of course, and needing to design, craft, and tailor engagement in ways that are appropriate for the communities in which you're engaging. So thank you for that, as well as underscoring both the role of frontline healthcare workers, community-based workers, and the importance of sexual and reproductive health and rights. I agree with you absolutely. That is an issue that is often taboo, not talked about, not well understood or researched. And so more work can and needs to be done in that respect because of the compounding impacts on women's lives and families, et cetera. So thank you for those concrete examples. I'd like to turn to both of you, Lisa and Susana, from your perspectives. I appreciate, Alef, what you said about the components of partnerships that work and understanding everyone has a distinct but differentiated role to play. What would you both, from where you sit, point to as some of the key components that enable that alignment? Lisa, first to you, okay, and then Susana to you.
Thanks so much. And I'd like to answer that question just in the context of an example. One of the things that's come up a lot is this issue of diversity, and it came up after the pandemic. Should we diversify the supply chain? And that would mean moving to things like local production of medicines. And so when you think about the partnerships that would have to come together for that to work, you have to really start with saying, what's our common goal? And when we're dealing with a public health agency versus an industrial company versus a community activity, they can always feel very, very different. So when you get to that place and you say, well, we're not in the same train, but we are going the same place, and be really clear about what that place is. That's one of the most critical things. But I think the second thing that's important is to really be clear what needs to happen. Because if you skip a step, you don't achieve it. If you try to do everything at the same time, it starts to get a bit convoluted. Everything's a priority, but we can't do everything all at the same time. When you've got a mountain in front of you, you actually have to figure out which piece of the mountain you can bite off first so that you don't fall apart. So being strategic, making sure that you don't miss things, but particularly really making sure that you align on what that common vision and goal is, regardless of how you're going to get there and which piece you own. That's, to me, I think, one of the most important things.
And Susana, for you?
Yeah, from my side, I think the main aspect is that we have to talk to every chain. Every link of this chain. We have to understand people's perspectives, no matter where they may be, because coming back to my previous point, access does not mean the same for everyone, and understanding what are the challenges that each party is dealing with will help us come with solutions that can address those challenges. I think the partnerships may be seeking to address things and make systemic changes. For example, our long-standing cooperation with ICH, we're a member of ICH, where we work towards international harmonization. That's one side. But also the immediate needs, and here I'd like to highlight the excellent work that has been done by our member associations and affiliated companies, where they are seeking to help provide medicines to those in need, for example, during emergencies. And this is also super important, because the two are needed if we want to make sustainable change. I think one very element that is important in any partnership is that we have an open forum for free discussion, that we are engaging, that we are explaining our challenges, and we are seeking together ways of overcoming them. And engaging, for example, with stakeholders like WHO, where we're looking for solutions together. This is of paramount importance. This can actually make a difference in people's lives, and we can find ways to help address issues like what Lisa was mentioning before, the resilience of supply chains, for example, which is very important. And we are really thrilled with the opportunity to do this work together and to work collaboratively to reach solutions that matter. We're very committed to coming to the table, identifying things that we can do now to advance these collaborations.
And how the conversations and opportunities here today with everyone in the room are so important to achieving that. It reminds me of a conversation from earlier in the program with our friends at Essilor, who were kind of calling on all of us to think about the bold and kind of surprising types of partnerships that can really drive impact that's needed. And so, Alef, I'd like to turn to you in the final moments of our segment here. When you think about those partnerships and being able to make those connections that are needed from the local level upward in order to ensure that last mile delivery, what are the key factors for you that may not be well understood or appreciated from those elsewhere in the value chain?
I think for me, access is absolutely key when it comes to primary healthcare, and access in a way that doesn't interfere with people's lives for a 8 or 9 hour waiting period of time. So ensuring that there is adequate access to medication, to vaccinations for children, to consumables when it comes to sexual reproductive health, to PSA tests when people get older, particularly with men, we now do tests in order to test them for prostate cancer. All those kind of diagnostic tools that can help on a primary healthcare level to reduce the burden of care on a secondary level. I think for us that is absolutely key when it comes to achieving better health outcomes as a whole. When I think about 60% of South African pregnancies that are still unwanted today, then for me those stats are alarming, but at the same time something can be done about it. But it can only be done if the right diagnostic tools, the right medication and the right levels of care at a primary level and at a secondary level come together. So players in those area industries can collaborate with the likes of the WHO, but also with the likes of partners underground like ourselves, who are expanding our clinics on a monthly basis to reach more people. And I think for me that's key.
Yeah. And as Peter Sands was saying earlier, really keeping our focus on the impact. What are the partnerships that are driving impact? How can we focus on those, streamline those to really accelerate and catalyze action? Appreciate all of your work, and also elevating the different roles and responsibilities that organizations and that we all have to play, and lifting up lived experience and what is happening in communities on the ground. In order to showcase that and to end on a positive note about the work that you're doing, love to share a video that encapsulates some of Alef's your work in South Africa and how that can be applied elsewhere in the world. So thank you all for your work, and if everyone could turn their attention to the screens.
My name is Ulebogeng Mumakwe. This is Diepsloot. This is my home. It's overpopulated. We've got more than 400,000 people living here.
Where we stay, there's no electricity, and the toilet, it's on the street. It's not healthy. It's not safe.
We've got 2 public clinics. You have to queue there from 5 until 3. We don't have a hospital, and we've got us.
You need health to create a thriving community.
When I hear nurse, I hear caring, I hear love, I hear uplifting, I hear giving someone else a chance. It's about hope. Community nursing is important to me because I feel that we're part of the community. We understand, and yes, we are the first line of defense. We are also the protectors of the community.
Thank you, everyone.